Good afternoon, ladies and gentlemen. My name is Carly Gilliland, and today I'll be informing you of a certain surgical procedure that is performed on many and the side effects of that procedure. But before we begin, I want you to think back to the last time you got a cold was. Now, regardless of whether that was a long time ago or recently, you may ask yourself what helps protect you from germs and also getting sick. Besides eating your Louise for breakfast, wearing proper clothing according to the weather, and staying active, there are also other factors out there that help protect you every day. For example, every time you breathe, your tonsils and adenoids are at work fighting against germs to help keep you healthy. Now, in some instances, your tonsils may need to be taken out due to infection. A prime example of that would be my roommate, who just recently had her tonsils removed, and she will tell you that it was no walk in the park, but definitely worth it. Now, right here shows tonsils at their normal size. Over here is a picture of my roommate's tonsils. As you can see, very swollen, very uncomfortable. Now today I'll be discussing three main points about tonsil removal. The first being common candidates for tonsillectomy. Second, the signs to look for indicating you might need your tonsils removed. And last, the pros and cons of the aftermath of the surgical procedure. To begin with, according to an article by Nicholas Herzen and Steele about tonsillectomy, the average age of a patient in 1995 studies was 8 years old, ranging from 2 to 17 years old. Also, other research about tonsillectomy by Michael and Daniel Stevens indicates that tonsillectomy procedure is more painful in adults than in children, and also the recovery period is longer for adults than for children. Now, there was no concrete reason given as to why this procedure is more painful for adults, but it could be that children just didn't remember the pain, or maybe it's just really more painful for adults. But needless to say, you may have your child checked and have their tonsils removed if need be. In addition to the common candidates for tonsillectomy, you may want to know what signs to look for that will tell you if you need to have them removed. Now, aside from the doctor telling you, here are some signs that lead to my second point of knowing if you need to have them removed. Recurrent tonsillitis, which means swelling of the tonsils, as indicated. Sore throats and fever are some sure signs letting you know that it's probably time to get them checked and, if need be, removed, according to the Robert Lindra's study of tonsils. In the case of my roommate, the swelling of her tonsils to almost golf ball sizes was what rendered her to have the doctor check them out. Not only should you watch out for these particular signs, but you may also wonder what side effects can and may occur after the surgery. For my last point, the pros and cons of having your tonsils removed. As a rule of thumb, different procedures constitute different results. So not every procedure of tonsillectomy is going to be the same. But a study showed that 844 patients receiving coblation tonsillectomy had less postoperative pain and earlier return to normal daily activities and few secondary infections than 743 patients receiving blunt dissection with bipolar diathermy homeostasis, according to Parker and Wallner tonsil research. Parker and Wallner also stated that coblation tonsillectomy has minimal thermal damage, which means there won't be as much bleeding and it will be as less painful afterwards. Although medicine is given after surgery, patients still have some negative side effects. According to the efficiency and safety of tonsillectomy, nausea, vomiting, and hemorrhaging, and also other complications are common side effects after a tonsillectomy. Now, in the case of my roommate, she had very severe hemorrhaging to where she was bleeding and she had to get another surgery. But sometimes that's not the case, and it's like 1% chance that that's actually going to happen. Also, the loss of a normal diet is a negative effect. Again, my roommate, it took her 2.5 weeks to return to eating solid foods. So that can be kind of a downer after the surgery. Keeping these in mind, the benefits are more rewarding than the negative effects. Tonsillitis, which can be annoying and a recurring problem, will never again return if you have your tonsils removed. Also, allergies, ear infections, colds, sore throats are lessened with the removal of your tonsils. According to an article by Omar Ford over tonsil removal, the surgical procedures allow for removal of the maximum amount of disease-causing tissue, which protects the delicate throats. Now, in conclusion, I myself still have my tonsils and I hope to keep them as long as I can. However, going through the last month of seeing my roommate suffer from the swollen tonsils to having her tonsils removed, there are definitely a lot of things to think about before getting mine removed. Although she's on the downward slope of the pain, watching her not being able to eat solid foods for almost 2 weeks and having trouble even eating soup has me wondering if the pain was worth it. She says that the pain and all the rest of it was worth getting her tonsils removed so tonsillitis will never strike again. Although there are some negative side effects, the positives always outweigh the negatives. For my last point, I would like to say that if you have a child, it would be best to have her tonsils checked and if need be removed too, so that the pain will be less memorable if the child or adult is over the age of 18. Now I'd like to thank you for coming here for my speech tonight. I hope you were informed and have a good evening. Thank you.